We have a brave volunteer and a beautiful woman, Jessica, with us. The reason she's here is to get a little bit of Restylane into her upper lip. She has a slight bit of asymmetry where her lower lip is more full than the upper lip. Now, the important thing is to consider the different proportions of the lips. Classically, you want the lower lip to be slightly fuller than the upper lip, but more women today like to have both lips the same size, or even go for a more seductive, sensual look where the upper lip is even a little bit fuller, but you want to make sure that the upper lip does not overhang the lower lip, because then it gives a real fake and plastic appearance. Most of the time when we do lip injections, patients choose to either have dental block, where I use numbing medicine to numb up the entire bottom of the face. Basically, the entire lip area goes numb for about an hour and a half or so, and it makes the procedure very comfortable. However, some patients don't like that feeling of numbness that lingers for about an hour and a half or so, and they choose to have this under local. In these situations, I use a little bit of topical numbing, which is a numbing gel to help with bearing the pain. So I use a little bit of numbing gel, which tastes like bubble gum, but it does definitely work. And I apply this not only on top of the lips, but I also apply it on the buccal mucosa. And this definitely helps a little bit, and it does take the edge off a little bit. Now, pain is so subjective. Everybody's got a different pain tolerance and pain level. Some people tolerate the lip injections without even flinching, and some people definitely choose to go with a dental block if they ever try this on the local. The beauty of it is, no matter what, it's a quick procedure, and it does not last that long. The downside is that the lip is a very vascular area, and bruising is a definite reality. So in addition to a little bit of swelling and a little bit of bruising, I always recommend to my patients that if they have a major party, social gathering, event coming up, not to do this the week before and to give themselves some time. However, most patients seem to be okay and ready to go and present back to work or school or their daily activities within about 2 days after this procedure. For this reason, Fridays seems to be a very common time for these injections, as people get a chance to recuperate over the weekend. Now, as we talked in the previous series, we have lots of choices for injections. The two most common injections are Restylane and Juvederm. They're very similar, different companies. They last about 6 months or so each. Similar in cost, similar in nature, slightly different in molecular bonding structure. They're both hyaluronic acids, and they're both very safe. They're already found in lips and in skin. There is almost no risk of allergy. I say almost because anybody could be allergic to really anything, but when there is a case of allergy, it's a reportable case and it's not very common at all. The other class of safe lip injections or fillers are the collagens, which have been classically around for quite some time. The problem with collagen is that they only last about 2 or 3 months, and most patients choose to go with something that lasts a little bit longer. Finally, there's other choices such as Artefill, Radius, things that last longer. However, I don't recommend these, although some people do inject these in lips, because there is a 3% or higher chance of getting nodules and inflammatory problems, and I think that's just too high for elective cosmetic procedures. Lastly, there are lip implants, fat injection, alloderm placement, and other choices, as well as lip surgery in forms of lip advancement, lip lifts, as well as resurfacing that enhance the lips. But in the most patients, especially in the young, beautiful patient that just wants a little bit of enhancement, injection of Juvederm or Restylane really becomes the most common procedure. So I take a little bit of alcohol wipe, and I take off this numbing medicine that I placed on her. And again, we talked about with Jessica, she has great lower lips. We're just going to basically inject her upper lip. Jessica, go ahead and put your head back for me so it's not wobbling. Perfect. Now, Restylane comes in a sterile container. You open it, it comes in 2 different sizes, a 1 cc syringe and a 0.4 cc syringe. This is a 0.4 cc syringe. It comes with a very small needle, the same size as the insulin needle, and it's a clear gel. So the way I like to start injecting is by starting just a little bit from the lateral or oral commissure, and then working more centrally. You do not want to really start filling in the lateral lip or the commissure too much, because it again creates a very fake appearance. Lips, as we talked about, are very vascular, and bleeding is common. However, bruising is not major. She's very brave and she's tolerating this very well. As you can imagine, getting a needle directly into your lips is not fun, but it is bearable, and Jessica is demonstrating that. The advantage of Restylane is that you only have to do this about twice a year. Some surgeons like to stab as they penetrate, thinking that as they stab, there's less pain because of less pressure. I've made her cry, but she's tolerating this very well. And you can see the results are pretty much immediate. Now what I like to do, typically with these situations after I place the injection, is just gently massage the area. The reason is the filler, be it Restylane or anything else, goes in as little tiny pearls. And if you massage it at this point, it'll flatten it out and distribute it nicely. Leaving it in as a pearl may show up as a bothersome nodule. And there you have it, the final result. And with the final result, you can see that the lips have plumped up nicely and there's very little bleeding. Jessica can lift her head up. There's very little bleeding. I do encourage use of ice after the procedure for a few minutes, and you can immediately wear makeup and lipstick if you choose to. Thanks, Jess.